So going into the program, what were you maybe like thinking? What would you do afterwards, or did you have that idea, or like how did all of that progress for you?
Yeah, so well, I have to say that when I finished my MPH, I knew I wanted to go and get a doctorate. I knew. I just really liked it a lot, and I thought I would want to be a professor, and I just really loved it. And so I worked for 1 year in New Jersey, actually, the medical school, and that was because I had a contact from one of my professors at NYU. So so networking is really important. I can't even stress that enough. And I'm not saying that you need to have a network with thousands of people. I mean, just think one or two people. That particular professor, I had asked her, and she gave me the names of two people. And this is again before internet, email, even. I called, had to use a phone, called, and and I was lucky that that one person that I called, they called back. And then I was able to get an interview. And then that's how I started working. And it actually was an agency. It was a project from the UMDNJ, which is what they used to be called. I think they changed the name of the medical school. But I worked in Perth Amboy in a really small project. And it was alcohol, tobacco, and other drug prevention program. And so what happened, what led me to California was my husband's job. So he had a feeling that there was going to be layoffs happening. And so he started exploring other options. And the other option was finding work outside of New Jersey. In San Francisco was one of the places that opened up. And so when we found out that he got the job, then we left shortly thereafter. But when we found, well, during that process that he found out that he got the job in San Francisco, I had to figure out, well, what's going to happen to me, or, in terms of my profession. And I was pregnant with our first daughter. So I was, and this is also true, I was reading an article about school-based health centers. And after I read that article, I said to myself, this is where I want to work. This is where I want to be. And again, being very old school, picked up the phone, called San Francisco. And I somehow was connected to the only, and at that time I did not know that, the only school-based health center in San Francisco, and got to speak to the director of the clinic, who became my boss eventually. But that is how that happened. So from moving from New Jersey to California, and then starting work shortly thereafter as a health educator, where I wound up staying there for close to 25 years.
Well, thank you for sharing that. Definitely gives a little context into how you got there and the health education work that you were able to do as well. Would love to hear if there were any like big takeaways from your MPH program, or any like lessons that you want to share with us.
So definitely with the MPH program, the one of the we heard this so often, and now this is why we was talking about the social determinants of health. So how everything was related to our social economic status, and at the time the example that was given, that because I was in New York and it was during the talking about the AIDS crisis, that you could be in one zip code and then you just go up another couple of blocks at a different zip code, and the health outcomes of people are vastly different. And this is just in a couple of zip codes in one city. So that was a huge lesson for me as a public health, as an MPH student. The other one was learning about hepatitis B, and at the time it wasn't really a big, like right now, how you know youth have to be immunized for hepatitis B, but back then not everybody was immunized. But I remember that there was a guest speaker that talked about hepatitis B, And I assure you that right after I heard that talk, I got that vaccine. So those are two particular takeaways for me. The I guess one other one I just thought about was the program planning class that I took. I really enjoyed that in terms of developing program, and that really actually helped me a lot in terms of developing future programs, which led to working where I worked at the clinic. And program planning, I think, was really one of the best courses that I took in my MPH program.
Very practical course, and I definitely think we can all benefit from that kind of course.
Yes.
But I appreciate you sharing that. That's very, very helpful.